Hello everyone, welcome to the Ask Dr. Rita show. Today I have a beautiful topic here that says, what are the signs that I have diabetes and what is diabetes? And so because I know I'm talking to people who are not in the medical field, as much as possible, I keep my explanations as simple as possible. What is diabetes? Diabetes is a chronic disease that affects millions of people all around the world, and it's simply a condition in which the body is not able to either produce insulin or utilize the insulin that the body produces, causing there to be an abnormal level of sugar, which we call it sugar, but glucose in the blood. There are two types of diabetes. There is a type 1 diabetes, which is the childhood onset, which happens usually from childhood, where the body, in some cases, the pancreas doesn't even produce insulin. And then, so that is a childhood onset and the person requires insulin. And then there's the type 2 diabetes, which usually comes after the age of 40. But now we even have children who have type 2 diabetes, which is a condition where the body is now not able to utilize the insulin that is produced. And then that causes there to be high levels of sugar in the blood. Now, what are the signs that someone may have diabetes? Sometimes, most of the times, people have diabetes and they are not aware that they are diabetic because the symptoms also mimic symptoms of other illnesses. And so it has stayed, the high levels of sugar have stayed for so long that they didn't know. They may have been even taking some other remedies. Some even assume that it is spiritual, whereas it's diabetes. So what are the signs of diabetes? Number one classical sign of diabetes is increased thirst and frequent urination. Sometimes people have frequent urination and they are not diabetic. And then there are also times when people have frequent urination and they are diabetic. So not all frequent urination is associated with diabetes, but frequent urination is one of the classic signs of diabetes. But increased thirst and frequent urination going together usually points towards high level of sugar in the body. Now, when the level of sugar in the blood is too high, one of the ways that the kidneys compensate is by causing there to be escape of glucose in the urine, which is called glucosuria. And so when the person pees on the surface where maybe on the ground or something, you find that ants go there because of the presence of glucose in the urine. The person can, that happens. And so there's frequent tests because of the heaviness of glucose in the blood that drives the body into dehydration that causes the body to experience thirst. Now, also there is fatigue. Fatigue is a situation where you feel tired all the time. You wake up in the morning, you're tired. Whether you have rested or not, you just feel tired. So that's because the body is not converting the glucose in the blood into energy. Now, when there's too much sugar in your bloodstream, your body is not effectively converting into energy, and then it's not being used, so you get tired. Then also there's blurry vision. Blurry visions happen when the sugar levels are so high in the blood, they begin to affect your sight. So you wake up in the morning and it seems like you are seeing that like there's clouds covering your eyes. These are because of high levels of sugar in the blood. Also, another symptom which may not usually be very fast to observe is slow healing of injury. That may not be fast because people don't wound themselves every day, and a minor bruise may eventually get healed depending on the level of the sugar in the blood and the lifestyle of the individual. That may also contribute, but in diabetes, injuries are slow to heal. Also, when the levels of sugar are very high in the blood, something else that you experience is dry mouth. Of course, because there's sugar in the blood, it causes the tissues around the mouth, in the mouth and around the mouth to be dry, and then they crack. Now, this dryness causes itchiness on the skin, itchiness in the private area, itchiness in the anal area. Then also there may be increase in weight or loss in weight. In diabetes, sometimes they may just notice that they are beginning to lose weight. They get hungry all the time. They get tired all the time. they are eating so much and they are losing so much weight. In fact, that happens when your body is not able to utilize insulin properly, or when your body is not producing insulin properly, and then it causes you to retain water in your blood when your sugar is high. Then also at some other point, there's numbness and tingling of the hands or the feet. Usually in the cases where somebody is experiencing numbness, the nerves are already becoming affected by it. Usually, those are not usually at the early signs, but mostly at the tail end. But sometimes too, people experience it because the nerves are beginning to be getting affected. Then also there are frequent infections because of sugar. Sugar enhances the growth of bacteria. Bacteria like sweet places. They don't like to stay in bitter places. That's why if you notice the antibiotics you take, most of the antibiotics are very bitter. That's just by the wayside. But bacteria like sugar. Sugar likes bacteria. So when there's presence of high level of sugar in the blood, bacteria, frequent infections can come. Also, some of the signs of diabetes can also be digestive issues. The person is experiencing issues that have to do with cramps after eating, indigestion, person experience burning sensations. So these signs, sometimes people think, I have ulcer because I'm having this, but it may just be diabetic. So it's always good to go and check. And then unusual cravings. You have cravings for sweet things. A lot of cravings for it. If you find yourself craving for sugar a lot these few days, maybe it's time for you to go and check your sugar level, because while there is excess of sugar in the blood, the body is having a deprivation of glucose because it's not utilizing. Insulin is needed for the body to be able to properly utilize glucose. So when there's a problem with the utilization of insulin of glucose, that means that there's a problem with glucose, either production of insulin or the use of insulin. The beta cells of the pancreas are responsible for this. For anything that affects the beta cells, affects insulin production, affects insulin utilization. And now when it has affected the production or utilization of insulin for glucose, then the body is, although there's plenty of glucose in the blood, the body is in need for glucose because there's no insulin. Insulin is like the door that allows the glucose to pass into the cells. So the cells are deprived. So that causes craving for more sugar. And then you eat more sugar, and then the body is still in need of sugar. So that it's just a circle. So let me explain the circle again in simple terms. The circle is this. This is insulin. Insulin is here. Insulin is what is required for glucose to be absorbed. The beta cell produces in the pancreas is responsible for this. This insulin is like a door that allows the glucose to enter into the cells. Now, if anything affects that door, this glucose is not entering into the cell. So the cells are hungry. The cells are famished. Then when there is this hunger and famish in the cells, the brain sends a signal. From the cells send a signal to the brain. The brain receives the signal and causes the nerves in the stomach to cramp for hunger and cause cravings. You eat the sugar-rich food. When you eat the sugar-rich food, it gets into the body. It stores as glucose in the blood, but it doesn't get into the cell. And so the glucose level begins to pile up until the person might even have diabetic acidosis. So it's just a circle. Now, for you to know whether you're diabetic or not, just a simple test will help you know. One of the simplest tests is either a fasting blood sugar, which is a test that you take in the morning before you have your breakfast, or a random test after you have eaten. Usually, if you go to see your doctor, they may recommend that you do a fasting blood sugar, a random blood sugar, postprandial test, and there are other tests that are done to check in your blood to find out what your readings will be in the next 3 months. Those are other assessments. Now, if you or someone you know is wondering or is experiencing some of these symptoms and you don't know what to do, you should ask Dr. Rita. You should contact me for a consultation session, and I'll be able to help you to know what to do. So I'll see you next time. Make sure that you stay well, and remember that perfect health is not out of your reach. Just know what to do and do it. Bye.